First things first, while we're recording. So we're good, we're live. First question is this. How do you like chiropractic over here?
Oh, I love it. You're great. Every time I come in here, you fix me up.
What percentage better have you been since we've incorporated Shockwave into your care?
I would say 80%.
Okay, so you went from like getting good chiropractic care to like getting really good chiropractic care and 80% better in terms of like stability and time in between sessions?
Yes.
Okay. Cool. And for anyone who doesn't know who's watching, this young lady has quite a degenerated bone on bone low back. By those red dots, you can sort of imply that there's a lot of arthritis. Arthritis just means a lot of wear and tear on bones, cartilage, joints. Has nothing to do with it. Discs for people that are out there. But discs can be compromised when there is arthritic changes. The first part of what we're doing here is called the Gonstead instrumentation and palpation check to see where the subluxations may be located today. And for all intents and purposes, subluxation means pressure on nerves, and it means nothing else. So come on up this way. Let's get started. A lot of people might see it and or be like, oh, that's cool. Like, I've never seen something like this before. This was really developed because people who traditionally would go on a high-low wouldn't really be able to get on a table like comfortably reaching on this way for them to just crawl onto a table because they'd be in so much pain. Is I like palpating from internal and external rotation of the SI joint and lower lumbar to see if the tissue is fixated in one vector or another. Like this one is internal rotation restriction by just a little bit on the lower back and the left side. We don't do side posture over here for people that have this type of condition. And if you want to know more about that, listen to more of my content. But right now what we're going to do is get the soft tissue loosened up. Then we're going to do an adjustment. And yes, this matters out there for people, as Jane can attest to. If you just go in off the street and someone lays down on your table and while they're sort of not ready and the body hasn't quite calibrated, pushing into their back is going to hurt a lot more than if you take a minute to do a Theragun or just sort of prime the area. I like to say priming the spine. It matters. You can also feel the tone of the tissue change in certain areas where this isn't just therapeutic, but it's actually an extra palpatory tool in the thoracolumbar, and just like much more hypertonic. Did you feel, is it the left, and you can say yes or no, but like, is it the left side of your back a little bit more?
Yes.
Yeah. Because right here I feel there's a lot of tension, and picking up a box today did re-irritate it.
Yes. It was the left side.
We did not rehearse this, internet, we did not rehearse this. And look up more. Almost. There we go. This way. There we go. All right, Jane, breath in and all the way out. And keep breathing. And all the way down. And then look up just a little bit. Relax that. All right, good. And breathe. Doing okay? Your neck and face comfortable, or do you need to move up? Yeah, come up an inch. There you go. Okay. Look up.
Oh, that was good.
Good. All right. Now we're going to prep this whole area here for Shockwave. So, what is Shockwave? Why do we do it? Let's take the time to educate the people. Turning up the energy on here so it penetrates a little deeper through the tissue. we're going to turn the frequency just lower so that it's a little stronger in between beats rather than the fast superficial beat, because we want to make sure we're getting to that discogenic tendon ligament level for chronic pain and scar tissue. A lot of people think that Shockwave is a tool to fight pain or stimulate healing. Yes, that is true, but that's too easy to say. For people that have chronic pain and that have a lot of built up scar tissue, that some surgeons or other doctors, well-intentioned or not, may say, oh, we need to go in and clean up all the scar tissue. We have to get the extra surgery. All this residual stuff may require another surgery or additional physical therapy or something. This Shockwave device is probably the best thing I've ever seen in terms of being able to treat those additional kind of chronic areas. Forgive the paper towel display. But Jane can attest to. And of course, Jane, feel free to take over this video. Tell everyone out there just how effective or how this feels.
Well, right now I'm in pain at level probably about a 7 or 8, and when I get up, I'm not going to feel any pain at all.
Well,
That's awesome.
that's hopeful. Man, I better come through today.
Yeah.
You better. Do me right today.
But what you should notice early on, you might see a flinch here. And that flinch is actually a great sign that it's working. And then you just work it over. The thing is, Shockwave is only as good as the user, the operator, in my opinion, in my experience. Because you can kind of get all over the place or use a setting that's not quite powerful enough, or too powerful, and get a less than optimal result. This feel right? Is this on the tender spot, Jane?
Yeah, right where you were down a little bit.
A little bit lower?
There, yeah, right there.
Okay. That's the key with this, everybody out there. You
We actually hear the change of the click.
Yeah. Because you want to be right where it's sore. You don't want to be floating around much trying to like hit all the areas. These protocols that are on that tube right there are in place for a reason. And you want to get as many beats in the area that's hurt as possible. We don't want you to be a 7 out of 10 out of pain, or I won't be able to sleep tonight. Oh, Axel. Dr. Axel's over here protecting me from myself.
I feel better. I still feel it, but I got it. I arranged it pretty good today, but it's better.